Hey guys, welcome back to the channel. So today I wanted to share with you guys an article that I read that I thought was super interesting. So this article is about using dogs to diagnose or at least find patients that have COVID-19. So I really wanted to just talk about this, and I think it's super interesting. This article comes from the AVMA, the American Veterinary Medical Association, which is kind of our overarching, you could call it association, professional association, where they kind of give us as veterinarians guidelines as to a lot of different things, and they offer us a lot of resources as well. So one of the things that they offer is news, which is pretty cool, but they also offer journal articles, and they offer, like I said, quite a few other resources for employment, for practice tips, all of those things. So as we see here, I'm kind of going to read through parts of this and kind of discuss it as we go along. So research teams in multiple countries are attempting to train dogs to identify people infected with SARS-CoV-2. Now, SARS-CoV-2 is the official name of what we know as COVID-19. SARS-CoV-2 is just a lot more of a technical term describing this particular virus and virus strain. Not a big deal for what you guys need to know, but it does matter a lot in the testing side of things, and it does mean a lot in the treatment side of things as well, potentially. And so far, the really interesting thing with this study is that as of right now, it looks like dogs have the ability to use their smell to be able to find organic compounds that are consistent with patients that are infected with SARS-CoV-2. So basically the body is producing very specific organic compounds or scents, and they seem to be able to differentiate those with that scent and without. It's a really awesome thing that dogs can do. Dogs are probably anywhere between 110 and 100,000 times better at smelling than we are, which is pretty incredible when you think about it. We can smell quite a few different things, and scents are something that we tend to remember, associate with emotion, associate with an experience that we had. But dogs can smell, depending on the dog, obviously, there can be differences, but they can smell up to 10 to 100,000 times better than we can. And the cool thing with this is they have more than 50 receptors for each one of ours that we have, and they tend to be more sensitive. So using them in applications like bomb sniffing or using them in drug sniffing is really cool. But to think that a dog can smell something as subtle as you having a very specific viral infection, that's pretty awesome. The study results from the partnership already indicate that trained dogs can identify scents produced by the human body during SARS-CoV-2 infection and distinguish them from scents produced during infections with other beta coronaviruses or influenza-like illnesses. So what that basically means is that it can determine, is this SARS-CoV-2 or is this another coronavirus like the common cold, or is this an influenza-like disease? Is it influenza? Something along those lines. And so a dog can differentiate between SARS-CoV-2 and one of these. The applications of a dog that has this level of intelligence and determinability of what they can smell is incredible. Think about using this in nursing homes where you can just have a dog go visit everybody once a day, and they can tell you if somebody has COVID-19 or SARS-CoV-2. This is just incredible. There's a preprint article from the Elfert team, the one in France, where they actually describe here, and you can read that right here, that these dogs started saying that this particular perspiration sample was consistent with COVID-19. So they kept triggering on this specific scent, but they had already tested negative on their PCR test. So they went back and they retested these people for SARS-CoV-2, and they came back positive. So these dogs were able to pick up a COVID-19 infection before it showed up on one of the better testing methodologies that we have for viruses like this, which is PCR. So some of the places that the researchers think that this might be a really good way to use it is for screening in large crowds, so that they can basically bring a dog through and they can sniff everybody and they'll trigger on whoever is potentially positive. Now, they can use this for places like stadiums or airports, or any other area where there's large crowds. And it would be relatively non-invasive, so they're not testing everybody, they're not sticking swabs up their noses, and then you don't have to prove that you're negative necessarily unless a dog triggers on you. And so it really could be a very interesting way to tackle this virus that we haven't seen before. And I think it's pretty cool. So in the Australian team, which is in conjunction with the second team, I believe, they're basically saying that they want to start implementing this in their hospitals here in the beginning of the spring. So December, January, probably January on, somewhere in there. And you know, part of the biggest issues with this is finding the right dogs that are actually going to trigger the right things and taking the time to train them, because it can be very expensive to do so. It also can be really hard to find trainers who are good enough with these animals to actually perform this kind of a job. In other news, I thought it would, now that we're on the topic of SARS-CoV-2 or COVID-19, I do think it's pretty interesting because we found that maybe SARS-CoV-2 is a little bit more prevalent than we originally thought, although I'll tell you why I don't think that's true here in a second. We've had up to 22 cases in dogs and cats, so 12 in dogs and 10 in cats where they have been exposed to COVID-19, either possibly or likely, and they have come back positive for SARS-CoV-2 on their test. Now, why do I not think this is more prevalent than we originally had thought, where we said they don't typically or won't get this? So currently we are up to 9.5 million people in the United States that have been infected with COVID-19, and yet we only have 22 cases where a pet has been confirmed positive. Now, one thing that I will say is that there probably are more pets that have had minor or non-symptomatic infections than have actually been tested. And part of this is because most likely in a host that's not normal, the infection that they will get is often going to be asymptomatic or going to be nondescript, and it will be mistaken for something else. So we don't really know a lot. Now, what is the role in pets giving SARS-CoV-2 to people? Well, as of right now, we don't have any data to say that they do or that they don't. So if you do have SARS-CoV-2, we obviously recommend that you distance yourself from people, but probably also your pets to some degree. I personally wouldn't worry too much about this from the standpoint of, if you're quarantining for 2 weeks, your pets can be quarantining for 2 weeks. And so you guys aren't going to be sharing, they're not going to be infecting other people. But more than likely, the way that a pet would transfer COVID-19 would actually be on their fur for momentary contact. So somebody sneezes on them and you go snuggle up immediately on your dog's face. That is a way that you could potentially, get SARS-CoV-2 or COVID-19 that would be more likely than your pet being infected and actually shedding the virus. So now that we've had that little talk and that conversation about COVID-19, thank you guys so much for watching. I'm trying out this new little bit of video type content to bring in a little bit of the news. So some of the really interesting veterinary research that has been going on, and in this case, One Health research, which I actually think my next video is going to be talking about what is the One Health initiative. And I think it's a really interesting topic, and I hope you guys will come back for that, as this video hopefully will lead into that a little bit and give a little teaser. So have a fantastic rest of your day, guys, and we will see you guys in the next video.